Each year, millions of people all over the world are hospitalized due to accident, injury, disease, or simply to give birth. During their hospital stay, some of these patients will develop infections. These are called nosocomial infections because they're acquired at the hospital while receiving care. They're responsible for several thousand deaths each year. The organisms that cause these infections are transmitted to hospitalized patients from both human reservoirs and environmental reservoirs. Human reservoirs include the patient himself, other hospitalized patients, caregivers, and visitors. Just like the water and the air, surfaces like floors, walls, bathrooms, and furniture act as environmental reservoirs. The hospitalized patient's environment also includes linens, food, and of course, medical equipment. In 80% of cases, germs are carried and transmitted to the patient via the hands. However, germs can also be passed from one patient to another via soiled medical equipment. When a piece of medical equipment, also called a medical device, such as a surgical instrument, compress, or drape, is not sterilized between patients, it can transmit germs from the first patient to the next patient, who may then develop an infection and complications. In some cases, these will be fatal. To prevent such infections, single-use medical devices have now become standard in hospitals in so-called developed countries. Single-use medical devices undergo industrial sterilization, are packed to remain sterile until use, and discarded after use to prevent microbial transmission. On MSF projects, use of such single-use medical devices is now standard practice for certain items such as needles, syringes, catheters, tubes, urinary catheters, endotracheal tubes, suction tubes, and others, sutures and compresses. But the use of single-use medical devices remains limited for storage, shipping cost, and especially waste management reasons. That is why some of the medical devices that are usually single-use in our hospitals are still sterilized and reused on MSF projects. This is the case with dressing and suture sets, oxygen humidifiers, suction canisters, surgical drapes, surgical gowns, and many others. While medical equipment from all of the treatment units must also be sterilized, the sterilization unit's main activity concerns surgical instruments and other medical devices used in the operating room. Even in developed countries, these medical devices are still, for the most part, multiple use, that is, reusable. It's therefore imperative to be able to safely sterilize soiled medical equipment to reduce the risk of nosocomial infection on MSF projects. Sterilization consists of destroying the germs present on medical devices and keeping the devices sterile until they're used. The sterilizing agent used at MSF projects is saturated steam. Germs are fairly resistant to steam. Every minute spent in an autoclave destroys some of the microorganisms. If there are a lot of hard-to-kill organisms on an instrument, only some of them will be destroyed, and the ones that survive can infect the next patient. That's why it's very important to reduce, as much as possible, the number of organisms present on the medical device before it ever gets to the autoclave. Sterilizing a medical device is therefore not just a matter of putting it in the autoclave. It is a multi-step process that includes collecting, washing and disinfection, packaging and autoclaving. Each step is important. While the behavior and expertise of the sterilization staff are crucial, the final result will depend on other factors, which must be dealt with correctly. This includes procuring the equipment needed for sterilization, which is the pharmacist's responsibility, and ensuring that the equipment is properly maintained, which is the logistician's responsibility. To function properly, the sterilization unit must have several different areas. A changing room, with a sink with water for hand washing, a place to store street clothes, a cupboard or shelves for clean clothes, and if possible, lockers with keys for valuables. The area reserved for processing instruments must have at least 2 different rooms. The first room will have, at minimum, a receiving area for soiled materials, a wash tub such as a stainless steel sink big enough to hold plastic transport containers or any other tubs used for soaking, and a drying table. The second room will have, at a minimum, a table for receiving clean, dry materials, which can be used for reassembling instrument sets, a packaging table with a cylindrical rod nearby for hanging sheets of sterilization paper, crepe paper or non-woven, without damaging them. For facilities with a high activity volume and several autoclaves, an additional large table that can be used to hold packs that are ready for sterilization. The second room also includes an area for the autoclave or autoclaves, as well as a table for putting down and checking the packs as they come out of the autoclave. If possible, an area can be reserved for temporary storage of packs awaiting distribution to the treatment units and operating room. The sterilization unit should have a room with a sink with running water for storing maintenance equipment like the housekeeping trolley, bottles of detergent, disinfectant, and spare tubs. Within the hospital, the sterilization unit should be located as close as possible to the operating room. The sterilization unit should not, however, be inside the surgical suite. While the 2 units may share a changing room, the other spaces absolutely must be completely distinct. Sterilized packs are transferred from the sterilization unit storage area to the operating room storage area. Personnel working in the sterilization unit use the changing room to remove their street clothes and put on their work clothes. There should be a sink to allow the staff to wash their hands when they arrive at the unit and whenever necessary throughout the day. The basic work outfit is a bouffant cap, a short-sleeved tunic, pants and clogs. The staff in charge of washing instruments should protect themselves from accidental exposure to blood with safety glasses and thick gloves. A plastic apron should be worn during washing to protect work clothes. The staff in charge of sterilization should use heat-resistant gloves for opening the autoclave and removing the metal baskets after sterilization. After they're used in the treatment units and operating room, instruments are collected in transport tubs. These are plastic containers with lids. Some are equipped with a perforated basket so that they can be used as soaking tubs. During the surgery, the nurse wipes the instruments regularly to remove blood and body tissue. When the operation is over, the instrument should be opened and taken apart to prepare for washing, and checked to make sure they work. Defective instruments should be marked so that they can be replaced by new instruments when the sets are reassembled. The nurse can use leftover suture thread to do this. All of the equipment is placed in the container. Note: unused instruments must go through the entire process. To protect the environment, it's important not to contaminate the outside of the tub with the germs on the equipment. Gloves must be changed before closing the lid and transporting the tub. Again, to prevent the spread of germs to the environment, large instrument sets that do not fit in the transport containers should be wrapped in the unsoiled sheets of sterilization paper they came in. If the facility does not have a 24-hour sterilization unit, instruments used in the operating room outside normal hours should be left to soak in detergent disinfectant solution, which is poured into the transport tub to prevent blood and body tissue from drying onto them. In the treatment units, instruments should be collected and taken to the sterilization unit once or twice a day, depending on the unit's activity level. Whatever the configuration of the healthcare facility, soiled equipment should always be transported using universal standard precautions. This is not only to protect the environment by preventing the spread of germs in the hospital, but also to protect the staff by minimizing the risk of accidental exposure to blood by needle sticks or cuts. To do this, soiled materials should be transported to the sterilization unit in closed containers. After they're used, the transport tubs are washed and disinfected in the sterilization unit. Then they're taken directly back to the operating room for the next surgical procedure. Pre-disinfection consists of letting the materials soak for at least 15 minutes in a detergent disinfectant solution. This requires a graduated tub, a detergent disinfectant product in a bottle with a pump dispenser, or a 50 milliliter syringe. To prepare the bath, begin filling the graduated tub with water. Turn off the water before reaching the desired volume. Add the detergent disinfectant solution, using the appropriate amount for the desired volume of water, 25 milliliters of product, or 1 push on the dispenser pump for 5 liters of water. 2 pushes, or 50 milliliters of product for 10 liters of water, or 3 pushes, that is 75 milliliters of product for 15 liters of water. Continue filling to the desired volume of water. Allow enough water to completely cover the instruments. Always verify that the pump dispenser is working correctly. If the pump is not working correctly, use a syringe. Draw 25 milliliters for 5 liters of water. Be careful. Make sure that all of the equipment is completely submerged. For hollow parts, such as tubes, use a syringe to ensure that the inside of the tube is in contact with disinfectant solution. Soak for 15 minutes. Use a timer to ensure the correct soaking time. Then empty the bath water into the sink and rinse the instruments under running water. The first bath removes only part of the germs. A second bath is needed to remove the organisms that survived the first bath and blood and body tissue, which will be removed by brushing. The second bath is prepared in the same way as the first, with the same product and the same dilution. Use a soft brush for brushing. A surgical scrub brush is perfect for this. Pay special attention to hinges and serrated, toothed, or hard-to-reach parts. Note: do the brushing either in the bath or just above it in the sink to reduce spraying, which can contaminate the environment. Use a channel cleaning brush to clean hollow parts. Place brushed instruments in another tub. Empty the bath. Rinse the instruments with tap water. After rinsing, the instruments are placed on a clean drape. They are dried with a clean, dry, lint-free cloth, and then placed in the packaging area. If the pump is not working correctly, use a syringe to dilute the detergent disinfectant. The instruments must be completely submerged. Use a syringe to fill hollow parts with detergent disinfectant. For brushing, use a soft brush and a channel cleaning brush. Certain equipment cannot be soaked in detergent disinfectant solution. This is the case, for example, with drills used for orthopedic surgery on MSF projects. The different drill heads go through the standard instrument washing and disinfection procedure. Wrap the motors in a cloth that has been soaked in detergent disinfectant solution, in such a way that the surfaces are in contact with the detergent disinfectant. Leave for 15 minutes to allow the product to work. Check the contact time with a timer. Wet a clean cloth with tap water and wipe the equipment with the damp cloth. Then repeat the operation. Brush what can be brushed, or rub the equipment down with a detergent disinfectant soaked cloth and leave in contact again for 15 minutes. Rinse. Wipe with a clean, lint-free cloth. The following items are needed for reassembling sets: alcohol-based solution, the instruments to be sterilized, wire instrument baskets or packaging containers specific to certain equipment, a magnifying glass and silicone-free oil, the lists of instruments for the various sets. Before reassembling an instrument set, begin by disinfecting your hands with an alcohol-based hand rub. Then use the magnifying glass to make sure that the instruments are clean, especially hard-to-reach places like hollow parts, hinges, and serrated parts. A drop of silicone-free oil is sometimes needed on moving parts to make certain devices work better. It's important to lock instruments, but only at the first setting so that steam can penetrate between the different parts of the instrument. When the instruments are ready, check the composition of the sets against the pre-established lists. It's important not to mix instruments from different sets. The standard packaging used on MSF projects consists of a wire basket into which the instruments are placed, wrapped in a double layer of crepe sterilization paper which keeps them sterile until use. Instrument sets used for trauma care and orthopedics are arranged in protective metal or plastic instrument organizers. These organizers are heavy and should be wrapped in non-woven sheets, which are more resistant to tearing and easier to handle than crepe sterilization paper. Some devices, like anesthesia tubes and surgical light handles, can be wrapped directly in crepe sterilization paper. Similarly, it's recommended that dressing and suture sets, with only a few instruments, be wrapped directly in crepe sterilization paper to minimize the condensation and space taken up in the autoclave. In this case, the sharp ends must be covered with small pieces of silicone tubing to prevent them from piercing or tearing the paper during handling. A specific folding technique must be used when wrapping baskets or instrument boxes with crepe sterilization paper or non-woven sheets. Envelope folding is the most commonly used technique. The so-called square folding technique is usually used only for packs of linen. It's important to follow the technique exactly, as this makes it possible to open the pack easily at the time of use without loss of sterility. Prepare the 2 crepe paper or non-woven sheets for wrapping the basket or instrument box. 1. Place the basket in the center of the diamond formed by the first sheet. 2. Fold the first corner of the sheet up over the basket or instrument box, making sure that the sheet is taut. Let the point stick out so that the pack can be opened easily. 3. Fold the 2 sides in over the pack. 4. And finish by covering everything with the last corner, which is folded over the pack and tucked in. 5. Repeat this operation with the second sheet. Seal the pack with the autoclave indicator tape. Fold the end of the tape back on itself to make it easier to open the pack. A pack that is difficult to open can cause a loss of sterility. Label the pack by writing the name of the set or device on the indicator tape. Use a special pen that will not pierce the wrapper and whose ink is steam-proof. Write the autoclave cycle number and the expiration date on the packaging. The expiration date should be no more than 2 weeks after the sterilization date. If there is more than one autoclave in service, write the autoclave number as well. Place the packs waiting to be autoclaved on a clean table. Always work on a flat, hard, uncluttered surface. Never work on a package of new sheets. During handling, wire baskets may damage the sheets below. Adapt the size of the sheets to the size of the basket or box to be wrapped. If necessary, cut the sheets to the right size. A sheet that is too small will not adequately protect the instruments, and one that is too large will form folds and channels that will retain water when the steam condenses, preventing drying. Use the correct folding technique so that the package can be opened without loss of sterility. Never reuse sheets, whether crepe paper or non-woven. They are single-use only. Double wrapping is compulsory for everything that goes into the operating room. Once removed from the autoclave, the outside wrapper is contaminated by microorganisms in the environment and no longer sterile. To ensure that these organisms do not enter the space known as the surgical field that surrounds the operating table on all sides, the outside sheet is removed before packs are placed on the Mayo table. It's important to use packaging appropriate to the autoclave available in the field. Some packaging materials are now obsolete and should not be used with the autoclaves on MSF projects because they do not keep things sterile. This is true of drums, the stainless steel boxes that were used in Pupinel dry heat sterilizers, kraft paper and cotton drapes. While sterilization containers, pouches and tubing are very good, more modern packaging materials, they're not appropriate for the autoclaves currently used on MSF projects. The TBM-90 is a small volume steam sterilizer. This 90-litre vertical autoclave uses electricity to convert water into steam. While a gas burner can also be used as the energy source, this requires a longer cycle and fills the room air with soot. The electrical heating element is at the bottom of the chamber, under a protective plate, and must be completely covered with water when the autoclave is operated using electricity. 2 metal baskets are used to load the autoclave. The cover is equipped with a seal to ensure that it's watertight once the wing nuts are tightened down. A red air inlet valve is used to bring the autoclave back to atmospheric pressure so that it can be opened when the sterilization cycle is over. A switch on the electrical box is used to set the heat level from 0 to 3. When the switch is in position 1, 2, or 3, an indicator light shows that the autoclave is turned on. The position of a counterweight along a metal bar determines the cycle temperature, either 134 degrees Celsius or 121 degrees Celsius, via its action on the pressure regulator valve. On newer models, the cycle is selected by opening or closing a black valve. When the valve is open, the steam pressure is 1 bar, and thus the temperature is 121 degrees Celsius. When the black valve is closed, the steam pressure is 2 bars, and the temperature is 134 degrees Celsius. The pressure gauge is used to monitor the pressure in the autoclave chamber throughout the entire cycle, and make sure it corresponds to the expected steam temperature. The timer, which is set to 10 or 30 minutes, signals the end of the sterilization plateau. 2 tanks are used for cooling the autoclave. The upper tank is filled with the coldest possible tap water. When the blue valve is opened, the water flows through the coil located in the bottom of the autoclave and empties into the lower tank. (1) All of the autoclave valves should be closed, except the green valve. A valve is open when it's parallel to the pipe, and closed when it's perpendicular to the pipe. 2. Pour the amount of water needed for electrical operation in the autoclave chamber, that is, 16 litres. If the autoclave must operate using a different energy source, such as gas, add only 8 litres, because the electrical element need not be covered by water. 3. Place the items to be sterilized in the baskets. Be sure to leave enough room between packs for steam to circulate freely. Do not overfill the lower basket, because if the upper basket rests on the packs, the paper may be perforated. The bulkiest packs should always be placed in the upper basket. 4. Place the baskets in the autoclave. Do not overload. The autoclave chamber should not be more than 2/3 full. If there's too little free space, there'll not be enough steam for good quality drying. Make sure that the packs do not touch the walls of the autoclave, otherwise they may get wet when the steam condenses along the walls. Both baskets must be used. 5. Cover the top of the upper basket, either with 2 sheets of crepe sterilization paper or with 1 non-woven sheet, which is more waterproof. This prevents the condensation that forms on the cover as the steam cools from falling on the load and wetting it. The condensation will run down the paper and drip down along the walls. 6. Close the cover. Tighten the wing nuts in diametrically opposite pairs so that the seal that keeps the cover watertight is compressed evenly. (1) Choose the appropriate sterilization cycle for the load to be sterilized. Atmospheric pressure is considered 0 bars, so we're talking about relative pressure. At the first notch, the relative pressure inside the autoclave will reach 1 bar. The temperature of the saturated steam will therefore be 121 degrees Celsius. At the second notch, the pressure will reach 2 bars, or a saturated steam temperature of 134 degrees Celsius. On newer models, when the black valve is open, the relative pressure will reach 1 bar, that is a steam temperature of 121 degrees Celsius. And when the black valve is closed, the relative pressure will reach 2 bars, or a steam temperature of 134 degrees Celsius. 2. Start the autoclave at maximum power, that is in position 3. 3. The autoclave must then be purged, that is, the air in the autoclave chamber must be removed so that steam can take its place. During heating, the water in the tank starts to boil and steam forms. When there's a continuous jet of steam escaping from the pipe at the green valve, close that valve by turning it perpendicular to the pipe. Steam will then build up in the autoclave and the pressure will rise. When the pressure gauge indicates 1 bar, reopen the green valve to get rid of the pressurized air that has accumulated in the bottom of the autoclave. The pressure then falls. Do not let it drop below 0.1 bar. Reclose the green valve and let the pressure rise again. Repeat this operation 3 times to ensure that all of the air in the autoclave has been removed. Note, during the 3 successive purges, always keep the pressure above atmospheric pressure, at least 0.1 bars, to ensure that no air goes back into the autoclave. 4. After the 3rd purge, reclose the green valve and let the pressure rise to the pressure needed for the desired sterilization plateau. When the pressure reaches either 1 bar or 2 bars, depending on the cycle chosen, set the timer for 10 or 30 minutes. It will signal the end of the sterilization plateau. A sterilization cycle is considered valid when all 3 parameters, steam temperature, steam pressure, and plateau duration, are achieved at the same time. That is 10 minutes at 134 degrees Celsius and 2 bars, or 30 minutes at 121 degrees Celsius and 1 bar. To keep the pressure constant at 1 or 2 bars depending on the cycle chosen, reduce the heat level when necessary by lowering the heat to position 1 or 2. 5. When the sterilization plateau is finished, turn off the heat by setting it to position 0. Open the yellow valve to drain the boiling water remaining in the autoclave tank. Be careful not to get splashed by the boiling water. Let the pressure drop to 0.1 bars. Then close the yellow valve. 6. For drying, fill the upper tank with cold water to the level of the grill. Open the blue valve to allow the tank to empty. This takes about 10 minutes. The cold water flows through a coil in the bottom of the autoclave. Upon contact with the cold water-cooled coil, the steam in the autoclave condenses, creating a negative pressure. The pressure must drop to minus 0.9 bars. This negative pressure, combined with the residual heat, evaporates the water, wetting the packs, thus drying them. When the tank is empty, close the blue valve, empty the water collection tank, and repeat the procedure. Seven. After the second round of cold water, leave the autoclave at negative pressure for 30 minutes to dry the packs. 8. Bring the autoclave chamber back to atmospheric pressure by opening the red valve. 9. Open the autoclave and remove the packs, being careful not to get burned. Use the baskets to prevent the packs from touching the walls. Do not overload the autoclave. Always do 3 purges. Respect the sterilization plateau duration, that is 10 minutes at 134 degrees Celsius and 2 bars, or 30 minutes at 121 degrees Celsius and 1 bar. Add 2 rounds of cold water to cool the steam. During the drying phase, leave the autoclave closed and at negative pressure. The TBM 90 litre is the standard autoclave for all Médecins Sans Frontières surgical missions. However, if the TBM 90 litre is not available or has not yet been installed, some projects will use the less effective All-American autoclave. With this autoclave, 134 degrees Celsius sterilization of surgical instruments is not possible. For safety reasons, the pressure should not exceed 1.4 bars, relative pressure, which corresponds to a saturated steam temperature of 127 degrees Celsius. In addition, the All-American does not have a cooling system. The cooling system is very important because it allows the packs to dry. As a reminder, packs that are not dry when removed from the autoclave are considered non-sterile. They can be used right away, but must not be stored. In terms of quality assurance, therefore, it's very important to scrupulously follow the autoclave's use instructions and to use the equipment sterilized with this autoclave quickly, that is, with no storage period. The All-American is a very basic autoclave. It consists of a small volume 39-litre autoclave chamber, a metal basket in which the packs to be sterilized are placed, and a perforated plate that goes in the bottom of the basket to prevent the condensation that accumulates in the bottom of the basket from wetting the packs. The inside of the basket has a guide channel into which the flexible tube used to remove air and steam is inserted. A cover with a handle, a flexible metal tube connected to an exhaust valve for air and steam, a safety valve, and a pressure gauge. This autoclave is not electric. It uses an external energy source, such as a gas ring. Caution: the autoclave must be handled with protective gloves to prevent burns. 1. Pour 3 litres of water in the bottom of the autoclave. Use good quality water such as bottled drinking water or filtered water. 2. Put the metal basket back into the autoclave chamber. Place the items to be sterilized in the metal basket. Do not crowd the packs so that the steam can circulate freely. Do not overload the autoclave. Load it to 2/3 of its maximum capacity. Instrument baskets should be placed horizontally. 3. Cover the load with a piece of crepe sterilization paper or an absorbent cloth, leaving a space for the flexible metal tube. 4. Position the cover, making sure that the metal tube attached to the cover is inserted in the basket's guide channel. The marks on the cover and the outside of the chamber should line up. 5. Tighten the wing nuts manually, 2 by 2, in diametrically opposite pairs. 6. Place the autoclave onto the heat source. 7. Open the purge valve, vertical position, and turn heat to high. 8. When a continuous jet of steam escapes from the purge valve, close the valve. Allow the pressure to rise to 1 bar on the pressure gauge. Then, open the purge valve to allow air out of the autoclave. Let the pressure drop to 0.2 bars. Then close the valve. 9. Repeat this operation twice more, for a total of 3 purges, to remove all of the air in the autoclave. 10. Sterilization. After 3 purges, begin timing the 30-minute sterilization plateau as soon as the pressure reaches the green zone. That is, a pressure greater than 1 bar and less than 1.4 bars. Adjust the heat source so that the pressure does not go into the red zone on the pressure gauge, but stays in the green zone for a pressure between 1 and 1.4 bars, or a saturated steam temperature between 121 degrees Celsius and 127 degrees Celsius. 11. Drying. After 30 minutes, turn off the heat source. Open the valve to let some of the steam escape until the pressure drops to 0.2 bars. The pressure should remain higher than atmospheric pressure, defined as 0 bars, to prevent non-sterile air from entering the wet packs. Close the valve and let the autoclave cool for 30 minutes. Keep the cover closed. During this phase, the autoclave cools and the steam remaining in the autoclave condenses, creating a negative pressure in the autoclave chamber. That negative pressure encourages drying. 12. Open the valve to return to atmospheric pressure or 0 bars on the pressure gauge. 13. When the pressure is 0, unscrew the wing nuts and open the autoclave. Remove the crepe sterilization paper or cloth covering the equipment. Remove the packs. Always do 3 purges. Sterilization plateau, 30 minutes in the green zone. Let dry with the cover closed. Note: check the condition of the flexible metal tube at least once a month. Make sure it's not clogged with limescale, so that air can leave the autoclave. Clean it if necessary with a small channel cleaning brush or a thin wire. If the flexible metal tube is too encrusted with limescale, replace it. Throughout the cycle, the person in charge of the cycle fills out a sheet, ensuring that every step is done. That sheet is also used for tracing the loads. Each sheet should have the autoclave number, the date and the person's name filled out, then the cycle number, the cycle type chosen, instruments or linens, the composition of the load, the pressure valve setting, the 134 degrees Celsius or 121 degrees Celsius cycle, the start time for the cycle. Then each step conducted is entered, the first, second and third purge, the plateau and its duration, the pressure reached, the first and second addition of water for cooling, the negative pressure achieved, and the drying time with the cover closed. This sheet should make the work easier and prevent steps from being forgotten, especially when there are several autoclaves operating at the same time. Traceability of the pack should make it possible to connect each instrument set used for a patient to the autoclave cycle in which it was sterilized. That is why the cycle number is written on the autoclave indicator tape. After removing the load from the autoclave, 1. The staff must check the dryness of the packs, that is, that there was good quality drying. Any damp or wet packs should be considered non-sterile and should not be stored. If these items are urgently needed, they should be used as soon as they come out of the autoclave. 2. The integrity of the wrapping must also be checked. Any pack whose wrapper is torn or perforated should be repackaged and re-sterilized in the autoclave. 3. After autoclaving, the autoclave indicator tape should show black stripes on a white background. This tape, which is readily visible, tells the operating room or treatment unit staff that the equipment has undergone an autoclave sterilization cycle and may be used. These checks should be entered on the cycle monitoring sheet. Checks whose results are satisfactory are marked off by the technician in charge of the cycle. Any problems observed during a cycle, such as packs that are wet when removed from the autoclave, steam escaping from the seal, or a power outage, should be noted on the cycle monitoring sheet. After autoclaving, the sterilized packs are transported to their place of use or stored in a clean location away, protected from dust and humidity. They should be handled carefully and protected from potential tearing. The packs should be put away according to their expiration date. Given the working conditions in the field, lack of instrument washers, water treatment, air treatment, and sophisticated autoclaves, sterilized packs should not be stored longer than 2 weeks.